Have you ever felt a strange tingling or pins and needles sensation in your hands or feet? Most people ignore it, assuming it's just from sitting in one position for too long. But what if your body is trying to warn you about something more? Today we'll reveal 8 possible reasons behind this common symptom, and the final one is something that should never be ignored. That tingling sensation may be temporary and harmless, but in some cases it can also be associated with nerve irritation, vitamin deficiencies, circulation problems, or other medical conditions. That's why understanding the possible causes is important instead of simply ignoring the symptom. But here's what surprises many people. One of the most common causes has nothing to do with poor circulation at all. We'll reveal that in just a moment. In today's video, we'll explore 8 possible reasons why your hands and feet may tingle, simple habits that may help reduce the risk in some situations, and the warning signs that mean it's time to seek medical advice. By the end, you'll have a better understanding of what this symptom could mean, but remember, only a healthcare professional can determine the actual cause. Remember, tingling in the hands and feet can have many different causes. This video is for educational purposes only and should not be used to diagnose any medical condition. If your symptoms are persistent, severe, or associated with weakness, loss of sensation, or other concerning symptoms, seek medical advice promptly. And now, let's begin with the cause that almost everyone experiences at least once, but very few people understand why it happens. Imagine watching a movie with your legs crossed for a long time. When you finally stand up, your foot suddenly feels numb or full of tiny pins and needles. It can be surprising, but this is one of the most common reasons people experience temporary tingling. In many cases, it happens because pressure on a nerve briefly interrupts normal nerve signals. The good news is that this type of tingling often improves after changing your position and allowing normal blood flow and nerve function to return. However, if the tingling doesn't go away or keeps coming back without an obvious reason, it deserves closer attention. But here's where many people make a mistake. The next possible cause isn't related to sitting too long, and it may develop slowly over months or even years without obvious warning. Vitamin B12 plays an important role in keeping your nerves healthy. If your body doesn't get enough vitamin B12 or has trouble absorbing it, some people may experience tingling or numbness in their hands and feet over time. This symptom can have many causes, but vitamin B12 deficiency is one possibility that healthcare professionals often consider. Vitamin B12 deficiency may become more common with age or in people with certain digestive conditions, dietary patterns, or medications. If tingling is persistent or accompanied by other symptoms, a healthcare professional may recommend testing rather than guessing the cause. But vitamin B12 isn't the only nutrient involved. The next possible cause has nothing to do with vitamins, and it may affect millions of people every day without them realizing it. Your nerves rely on a healthy blood supply to receive oxygen and nutrients. If blood circulation is reduced for any reason, some people may notice tingling, numbness, or a pins and needles sensation in their hands or feet. This doesn't always mean there's a serious problem, but persistent symptoms deserve attention. Healthy habits such as regular movement, avoiding prolonged sitting, and managing conditions that affect circulation may help support healthy blood flow. If tingling is severe, persistent, or accompanied by pain or skin color changes, it's important to seek medical advice rather than self-diagnosing. But poor circulation isn't always the answer. The next possible cause can gradually affect the nerves over time, and many people don't notice the early signs until the symptoms become more obvious. Over time, persistently high blood sugar may damage nerves in some people, particularly in the feet and legs. This condition, often called diabetic neuropathy, doesn't affect everyone with diabetes, but it is one possible cause of ongoing tingling, numbness, or burning sensations. The good news is that early recognition and appropriate medical care may help reduce the risk of further nerve damage in many people. If you experience persistent tingling, numbness, or burning sensations, especially along with increased thirst, frequent urination, or unexplained weight changes, it is important to discuss these symptoms with a qualified healthcare professional. But here's something many people don't expect. The next possible cause isn't a disease at all. It could simply be a mineral your body needs every single day, and most people don't even realize they're not getting enough. What if your body is trying to tell you it's missing an important mineral? Magnesium helps your nerves and muscles work properly. When magnesium levels become too low, some people may experience muscle cramps, twitching, or tingling sensations in their hands and feet. However, these symptoms can also have many other causes. Magnesium is found in foods such as leafy green vegetables, nuts, seeds, beans, and whole grains. Eating a balanced diet may help you meet your daily needs, but supplements should only be taken under the guidance of a healthcare professional when appropriate. But here's something even more surprising. The next possible cause isn't related to vitamins or minerals. It may actually begin in your neck or lower back. Did you know that a problem in your neck or lower back can sometimes cause tingling in your hands or feet? When a nerve becomes compressed, irritated, or inflamed, the sensation may travel along the path of that nerve, even to areas far from where the problem began. If tingling is accompanied by severe neck pain, back pain, muscle weakness, difficulty walking, or loss of bladder or bowel control, seek urgent medical attention. These symptoms may require prompt evaluation. For ongoing tingling without emergency symptoms, a healthcare professional can help determine the underlying cause. We've covered 6 possible reasons so far, but the next one is especially important because it may be linked to something many people take every single day without thinking twice. Here's something that surprises many people. Sometimes, the tingling isn't caused by a vitamin deficiency or poor circulation at all. Certain medications may list tingling or numbness as a possible side effect. This doesn't happen to everyone, and you should never stop a prescribed medication without first speaking to your healthcare professional. If you notice new tingling soon after starting a medication, don't ignore it, but don't stop taking the medicine on your own either. Contact the healthcare professional who prescribed it so they can determine whether the medication or another condition could be responsible. But we've saved the most important reason for last, because this is the point where tingling may need immediate medical attention. Occasional tingling that quickly goes away is often less concerning than symptoms that persist or keep returning. If tingling is accompanied by muscle weakness, difficulty speaking, sudden vision changes, severe pain, or loss of balance, seek urgent medical attention. These symptoms can sometimes indicate a serious medical problem that requires prompt evaluation. Today we've explored 8 possible reasons why your hands and feet may tingle, from temporary nerve pressure and vitamin deficiencies to circulation problems, diabetes-related nerve damage, low magnesium, spinal nerve compression, medication side effects, and situations where medical evaluation is important. Remember, tingling is a symptom, not a diagnosis. Finding the real cause requires looking at the whole picture with the help of a qualified healthcare professional. In our next Vital Bites video, we'll reveal why some people wake up every night with painful leg cramps and one common habit that many people never realize could be contributing to them. If you found this video helpful, please like, subscribe, and turn on notifications so you never miss our daily evidence-based health videos. Every day on Vital Bites, we share practical health information to help you better understand your body and make informed health decisions. Remember, this video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If your symptoms are persistent, severe, or concerning, please consult a qualified healthcare professional. Thank you for watching, and we'll see you tomorrow in the next Vital Bites video.